Influenza, the virus that causes the flu, is one of the most common infectious diseases. Now, there are three types of influenza that infect humans, called Type A, Type B, and Type C. Now, Type A, the most common type of influenza virus, can be further subdivided based on two of the glycoproteins on its protective envelope surface, H protein or hemagglutinin, and N protein or neuraminidase. Hemagglutinin and neuraminidase can vary a bit in their structure, so different versions are identified by a number. For example, type A, subtype H3N2, sometimes just called H3N2, has hemagglutinin number 3 and neuraminidase number 2 on its surface. H3N2 and H1N1 are the most common type A subtypes to infect humans, but they both also infect various animals. Type B influenza is less common, and it only infects humans and doesn't mutate as often as type A. Type B influenza only has a few types of H and N glycoproteins on its surface. Finally, there's type C influenza, which only has one species, and is the least common and least likely to mutate of the three. Influenza C usually causes mild disease in children, and unlike type B, it can infect both humans and pigs, transmitted when an infected person sneezes or coughs, which spreads thousands of droplets containing the virus into the local area, up to about 2 meters or 6 feet away. These droplets can then land in the mouths or noses of people nearby, or get inhaled into the lungs. The virus can also survive on surfaces for a few hours, so it's possible to get the virus by touching a surface, like a contaminated doorknob, and then touching your own eyes, nose, or mouth. Symptoms start 1 to 4 days after infection, and include fever, headache, runny nose, sore throat, and a cough. Most of these symptoms get better within a week, but the cough often persists for up to 2 weeks. There can sometimes be complications though, like acute otitis media, bronchiolitis, croup, sinusitis, and pneumonia, including antibiotic-resistant strains caused by Staphylococcus aureus and Streptococcus pneumoniae. The highest risk of complications is among groups like young children under 6 months of age, pregnant women, adults over 65 years old, and those with chronic medical conditions like chronic heart or lung disease. Young children in particular are more likely to have neurologic complications like encephalitis and febrile seizures. One unique complication is Reye syndrome, which is a condition where after taking aspirin while fighting off a viral infection like the flu, a child develops encephalopathy and liver disease. Although less common, all of these complications can also happen in previously healthy individuals as well. Now, the most effective way to prevent influenza is through vaccination. On average, the flu vaccine reduces the risk of illness by half, roughly falling from 10% to 5% in terms of likelihood of getting sick over the entire winter season, as well as the community. Since if the majority of a community is vaccinated against influenza, or any other contagious diseases, it actually protects the other members of the community, even those few that aren't vaccinated. Alright, so let's say that nobody's vaccinated, and one person gets the flu and then comes in contact with 2 other people. Those 2 people then get the flu, and each spread it to 2 other people, and this chain reaction goes on, maybe even causing an influenza outbreak in that community. But now let's say that the majority of people are vaccinated. In this case, the chain reaction can't spread through the whole community. So even if a few people aren't vaccinated, they're still protected. This is called herd immunity, because the herd's protecting the weakest members. This is especially important for people who can't get certain vaccines, like infants, pregnant women, or immunocompromised individuals, because they still get some protection when the spread of contagious disease is contained.